CT scans came into the picture, how much exposure does a CT scan do? It used to be believed that it's about 70 to 80, and the newer machines do the job so very fast and probably with much less radiation.
And I want to come to you with Dr. Thadani with that question. What about CT scans? A lot of patients, they are sort of, if they are getting a false negative and COVID symptoms are continuing, they are, so doing a sort of a self-diagnosis, or they are being advised to go in for CT scans. Are CT scans the answer that we are looking for?
CT scans have been used since the beginning of the COVID pandemic. Okay, Chinese were the first ones to say that CT scan is the most sensitive test as far as picking up COVID is concerned. For treatment purposes, it's very invaluable for us. However, there are certain caveats in CT scan as well. You can't do a CT scan too early in the course of the disease; it will come normal. CT scans are progressively will show progression of disease. So you do a CT scan around day 5 or day 7 if you're suspecting that the patient has lung involvement. You don't need to do a CT scan in all patients. Patients who have very mild symptoms, just the initial 2-3 days after that, they are completely asymptomatic. Those patients you need not do a CT scan. You can just continue only isolation. Any patient who is symptomatic around day 5, day 7, you should ideally do a series of blood tests. If the blood tests are suggestive or abnormal, for example, you do a CRP, it's high, you do a D-dimer, it's high. In those patients, you would be better off getting a CT test done because those patients are likely to have lung involvement as well. So CT scan also is not, foolproof in the sense you may get a completely normal picture on CT scan, but the patient may still have mild COVID. But if the CT is normal, essentially you would say that it's mild COVID. But again, it can progress, and the CT scan findings can become abruptly much worse within 24 to 48 hours also. So that is one thing we need to consider.
There are some doctors, including the AIMS director, who said that one CT scan is equal to 300 to 400 chest X-rays. But the Radiologist Association is saying that it's not that dire, that it is equal to 5 to 10 X-rays. Which is correct, he's asking, and because there is a lot of confusion around people on the harmful effects of CT scan as far as testing is concerned.
Well, we do like people to be exposed to minimum radiology as much as possible. But then this is a situation where a CT scan can be very helpful. And, in very serious cases, the progression of the disease sometimes, and the disease, as Dr. Thadani said, CT scan is a progressive finding which can increase, which can stabilize, then gradually decreases. The increase can be relatively rapid, but the decrease is very slow. So at any point, you maybe day 5 or day 7, whatever be the CT score, people keep asking, my CT score is only 8. Why I'm requiring oxygen? So because it might be 8 3 days ago, it might be 14 or 15 or 13, and the need for oxygen has developed. Now, coming to the radiation. There was a time when we always believed, when CT scans came into the picture, how much exposure does a CT scan do? It used to be believed that it's about 70 to 80 exposures of a chest X-ray. Now, again, CT scan, you are talking about an HRCT, and these days, if you actually have seen that this CT is done so very quickly in these cases, and the newer machines do the job so very fast and probably with much less radiation. If you do a contrast CT, then you need longer time. The exposure is much longer, many times longer. So, I don't know the Radiology Association's figure of 5 times of the X-ray or 10 times the X-ray. But certainly it couldn't be too much more than that with the newer machines which do a great job with relatively much little exposure. Those times of 300 X-rays, they are gone. and those are with contrast CT, which is not the case in HRCTs, that the way they are being done.
All right. So it's not as doomsday a picture as has been painted.
No.
Okay.